It's my great pleasure and privilege to introduce my colleague, Dr. Peter Cruz, who is the architect and key author of this program. Peter comes with an incredible wealth of experience, both academically and commercially, in senior leadership roles, change management, strategic business roles within polyclinics and hospitals, both in South Africa, the Middle East, and the UK. And it's this experience that has gone into the design and the development of the program. Peter, thanks very much. If you could give us some context, a bit of background to the program.
Thank you very much, David, for the introduction. And also thank you for inviting me to talk about how to future-proof your healthcare practice. Now, this question should be uppermost on the mind of all clinicians. I don't need to tell you that because you've had personal and practice experience of coping with COVID, but the concept of future-proofing is much broader than that, which is that future-proofing involves acquiring a body of knowledge, skills, attitude, and capabilities, particularly certain actions that we need to do in order to mitigate against what are perceived as disruptive or challenging threats to our practice. The essential capabilities of future-proofing include building in extra capacity so that you have some elasticity, some resilience, and building back sustainability so that your practice can withstand future shocks that are yet to come. And obviously, you can't easily prepare for a shock you don't anticipate. So you have to build in some redundancy as well. So in most countries we observed during the pandemic, the clinicians responded really well and worked long hours and basically dealt with the clinical loads and all the stresses that have happened and continue to do so. But to be frank, and I'm making a generic comment here, generally speaking, the managerial backup and the operational support systems, what we tend to disparagingly call the back office, the myriad of non-clinical functions that actually run our healthcare systems, such as logistics and supplies, inventory, stock control, staffing, provision of beds, medication, etc., lagged behind the standard required by the clinicians. And one reason for this is that operational and managerial skills like this are not generally taught in medical schools. So most clinicians and practitioners don't have these skills themselves. And so we rely on other professional people, generally trained at business schools and colleges and technikons, to do these things for us. But these are the very skills that we need as clinicians in order to provide the team leadership in our practices. And even if you're not going to do it yourself, you need to know this stuff and understand it so that you can manage it.
Fantastic. Thank you, Peter. What is the background context of the Future-Proof Your Healthcare Practice course?
There was already an evolving trend in digital healthcare with wearables and remote monitoring and technology like that. Virtual telepractice was practiced in many parts of the country. And another driver for us at the time was the recognition that South Africa, as a developing country, really had a problem and a challenge, which we knew that COVID would make worse. And essentially, because we have a very large disease burden and fewer resources, we have to serve too many patients with too few clinicians. So there was a pressing and overarching economic need to take the healthcare talent and resources that we had and spread them more affordably across the whole healthcare spectrum, rather than narrowly focusing them on just those who could afford to pay. And so this was the thinking behind the course, and which led us to teach and learn about how to adapt our current business models, not do away with them, but add a new modality of telemedicine, telepractice, so that we could do more with less.
So with that in mind, then, what is the purpose of the program and its objectives?
Well, the course is designed to teach the knowledge, skills, and attitudes that I described that clinicians will need to better navigate and adapt to some future disruptive challenges like COVID. We empower practitioners after the course or during the course. The product that they emerge with is a 90-day action plan in order to future-proof their own practice. So we teach them to virtualize, to digitalize, to interconnect, to pivot and change the business models to include both conventional face-to-face practice and, where appropriate, virtual telepractice. We also teach awareness of all the other enabling elements that they need to make this happen. There's some hardware requirements, software requirements, chatbots, mHealth, that sort of thing. But these are not expensive, they are affordable. We find that the most important element is a change in mindset, to be open to adding this modality to the practice because of the advantages that it brings. And there are also other enabling frameworks such as regulatory compliance, the need for data protection, privacy, confidentiality, consent, and also the need for cybersecurity to protect both the practice, the data, and the patient from hackers. So we teach courses in each of these topics. Finally, we had to try and remember that we are on planet Earth, and that basically there's no planet B. And so if we're going to be tinkering with the fundamentals of the way we do business in our medical practices, we may as well take the opportunity to build back a better practice, one that is leaner, so it consumes less energy, generates less carbon and waste, and also that's essentially therefore greener, and so it can make a contribution to the planet, to make things more sustainable.
Peter, can you
Correct.
possibly take us through just a quick snapshot of elements of the curriculum so that we can have a look at what that looks like, please?
The first point is that there are at least 10 key concepts that one has to absorb. This is about the awareness and the knowledge that one needs. The first of which is to reimagine healthcare, that there's another way of doing things, which is additional. The next point is to realize that we've got to make healthcare interconnected. So we end up with the ideal of a single portable digital patient record, which moves with the patient whenever they are referred to hospitals, specialists, laboratories, or radiologists. We teach the concept of future-proofing, how to create spare capacity, resilience, and sustainability. We teach how to pivot your business model, and I'll do another slide on that later. And then the important concept of digitalization. The sixth concept is virtualizing. That's using Zoom, Skype, or other video methods, text such as WhatsApp, and telephones for consultations to enable you to be separate from your patient, partly because of COVID, but also because of distance and other factors. We make you aware of various kinds of software, artificial intelligence, and chatbots. This sounds very fancy, but basically just means that your appointments can be automated, that your receptionist doesn't have to answer telephones. The patient can book an appointment when it suits them, see what your diary looks like, choose the date and time, and make the booking. If they only want to order a repeat prescription or a sick certificates, they can say that in advance. So there's no need for them to get into a car and drive, generating carbon and waste and consuming petrol, and go and sit in a waiting room with COVID symptoms, or perhaps pick up COVID from one of your other patients. There's the opportunity to build back better in a green sense. And changing your mindset, I think, is partly what it means, just to be open to the idea that there are other ways. And once you get into this, you'll realize that telemedicine and telehealth are here to stay. Key concepts and themes can be summarized into these 5 main headings without going through them again: the interconnection, the model innovation, the virtualization, the digitalization. We have separate lectures on each. And then last but not least, we do need to be aware and understand things like website manners instead of your bedside manner, how to approach a patient online, trying to make sure they're comfortable, making sure that you've got informed consent, making sure that they have privacy, and so on. Also, understanding how to protect the patient and the data from hackers, and also working within the regulatory compliance of the HPCSA, and also within the billing and coding rules of the medical aids. Now, why do we need all this? Well, as this cartoon illustrates, COVID-19 could be just a blip on the disaster horizon that's ahead of us. And certainly economic recession happens, and most of us have had some experience of that. Climate change is ongoing, as is biodiversity collapse, and these will have implications later. But there may be other unforeseen challenges ahead. It's not just pandemic related. You need to know some basic terminology. Telehealth is an umbrella term for any health-related services using smartphones, internet, or video. Telemedicine is the provision of such clinical services like virtual consultations. And mHealth has to do with the use of mobile and wireless technology, bearing in mind that many South Africans are digitally challenged, don't have internet, but just about everybody has a phone. And so the smartphone, or at least a capable phone, may be the way to go to reach more people in our country. I think it's important to understand that digital healthcare is very different from the sort of training that we got at medical schools. It obviously removes the important element of touch, which is bidirectional. So not only don't you have the healing hands of a doctor on your child's abdomen or listening to their heart, which is very reassuring for the patient and for the parents, but it also removes vital diagnostic information, which we get from physical examination. This can be partly replaced by wearables and medical devices, but it leads to another point, and that is we need to learn how to triage patients correctly and decide which patients it's appropriate to do teleconsultations on and which should have a face-to-face consultation or go directly to an emergency room. And so practice rules and regulations, policies and procedures, clinical pathways will need to be changed over time to reflect all this. It's also important to understand that digital and virtual and face-to-face healthcare are not competitors, they are complementary. And what we're trying to encourage is a hybrid practice. You decide the proportion of telemedicine versus conventional practice, and it varies from patient to patient. It can improve your practice efficiency. It can create the extra capacity that you need. And there's also a bottom line impact that you can save on staffing costs and other resources, and you can see more patients with less time if you do telemedicine. So these are your building blocks, which you put together as we go along. This is an important slide conceptually, where if we start off on the left with an upside down triangle representing your current practice, it's probably digitally light and face-to-face heavy. Without naming names, my general practitioner in Cape Town still uses manila folders. It's very analog. And what we want to do is to pivot the practice into the newer, more future-proof model in red on the right, in which there's much more virtual and digital practice and less of the face-to-face, so that the practice is more balanced. You do that by going through various barriers. You've got to overcome the mindset of your staff, the lack of training. There are some regulations from the Health Professional Council. You need a little bit of time, energy, and very little money to make this happen. In planning your telehealth journey, which we do with you, it's obvious that we start you bottom left with baby steps, and we build up as the course evolves with more challenging tasks. And eventually, after the 6 weeks, we're starting to tackle some really practical things. You're not just thrown into the deep end. So it is a step-by-step systematic approach. Our Dean, Jonathan Foster Pedley, provided this graphic, which reminds us that building a practice and working in real life and learning are systematic and interdependent. Work isn't a series of silos and functions which work independently. It's about multiple capabilities, functions, and perspectives, which we have to make work interdependently. So that's why there are so many building blocks, all of which we need to get right. If we can achieve these things, we believe that telemedicine will add maximum value to the healthcare profession. There is societal value to be had with better patient access and service, leaner, greener capabilities, and extra capacity. There's business value with lower operating costs and increased revenues and increased capacity. And there's clinical value, which has to do with bringing the consulting into the patient's home and providing a virtual consulting room, which is wonderful for someone who's out of town or unable to travel, especially the elderly and disabled. By using these methods, we believe that errors will be reduced and outcomes can be improved, and we will be part of a more interconnected ecosystem. And then finally, there are a number of other goals and objectives which are important. Basically, this movement of change, this injunction to join us and practice telemedicine, has benefits for patients, such as the improved experience and accessibility, availability. The journeys that they have are pretty safe. Outcomes have been shown to be as good or better. For practices, we create capacity, create efficiencies, lower costs, etc. And this is an important point for you as healthcare practitioners. For you, you may have a better quality of life. There may be more time to spend with your face-to-face patients. You may have a better work-life balance because you're going to choose when to do telemedicine and when to do conventional practice. You might be able to work a few days less a week, and your health and your life with your family may well improve. And then by design, the planet may benefit too, with sustainability, with less waste and carbon, and really a more environmentally friendly way of doing healthcare, which is long overdue. So in summary, we urge you not to be shackled to the past and to the old way of doing things just because that, like me, was what you learned at medical school, but instead to embrace the future and deal with it in a positive way with an open mindset, so that we can not only adapt to challenges like COVID or pandemics when they come, but we can, first of all, survive, and eventually, we're quite sure, it will enable you to thrive. Thank you.